Hi there, and thanks for joining me. My name's JBRNBSN, and in this video, I'm going to discuss about informed consent, the importance of it, and what is an informed consent, the role of the healthcare provider in terms of informed consent, as well as the role of the nurses. What I mean to say nurses is registered nurses, aside from being a client advocate. Also, informed consent is one of the most popular topics on NCLEX under management of care category, which comprises 17 to 23% on your exam. And you may receive questions about informed consent by multiple choice, or you may have it by selecting multiple responses, also known as select all of that apply. So, with all of that being said, let's begin. All right, we are now ready to discuss our main topic, which is informed consent. I hope you will gain information, knowledge about this content. So, what is informed consent? So, as what I have said in the intro, informed consent is under the NCLEX category of management of care, which is 17 to 23% of your exam. So, informed consent is a process of communication between the client and the healthcare provider that often leads to agreement or permission for care, treatment, or services. Every patient has the right to get information and ask questions before procedures and treatments. If adult patients are mentally able to make their own decisions, medical care cannot begin unless they give informed consent. Or legal representatives can also give informed consent if the patient is not cognitively intact or if the patient is underage. The informed consent process makes sure that the client's healthcare provider has given him or her information about their medical condition along with testing and treatment options before they decide what to do. So, the information includes the name of the client's condition, medical diagnosis, and the purpose of the proposed procedure or treatment in relation to the client's medical situation, who will perform the treatment or procedure, the name of the proposed procedure or treatment that the healthcare provider recommends, the risks, expected outcomes, and benefits of the treatment or procedure, and the risks and benefits of other options, alternatives, including not getting the treatment or procedure. So, signing informed consent means if the patient or the legal representative signs a consent, it means that it becomes a legal document. And when they sign the consent, it means that the client have received all the information about his or her treatment options from the healthcare provider. Number two, the client understands the information and he or she have had a chance to ask questions to the healthcare provider and is satisfied about the information received. The third one is the client used this information to decide if he or she want to receive the recommended treatment or options that have been explained to him or her, sometimes the client may choose to receive only part of the recommended care. And number four, if client agrees to receive all or some of the treatment options, he or she gives consent by signing a consent form. The completed and signed form is a legal document that lets the healthcare provider go ahead with the treatment plan. So, what is the big reason for signing a consent form? The main purpose of the informed consent process is to protect the patient or the client. A consent form is a legal document that ensures an ongoing communication process between the client and the healthcare provider. It implies that the client's healthcare provider has given him or her information about his or her condition, treatment options, and that they have used this information to choose the option that they feel is right for the client. What are the special considerations for informed consent? So, number one, informed consent is a process in which a healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. Usually, an informed consent involves invasive procedures such as surgeries, lumbar puncture, liver biopsy, blood transfusion, and so on and so forth. Those procedures need informed consent by the patient. Number two, second consideration, the patient must be mentally competent. It means cognitively intact to make a voluntary decision about whether to undergo the procedure or intervention. The patient must sign the consent on his or her free will, not being persuaded, forced, not drunk. Everything should be okay. The patient or the client understands the procedure and he or she then signs the informed consent. Next consideration, treatment cannot be given without the client's consent. And then the next one is the client can always change their mind even after the informed consent was signed and or treatment has already started. As an advocate, the nurse must inform the healthcare provider about the client's wishes. Next consideration, all clients have the legal right to autonomy and self-determination to accept or reject all treatments and interventions. When consent for any reason, including the lack of majority, mental incompetence, and unconsciousness, cannot be obtained, other people can provide legal consent for the patient. These people include the parent or legal guardian of a minor and unemancipated minor child, a legally appointed representative for a developmentally disabled adult, for example, an emancipated minor and the person who has been appointed as the client's durable power of attorney for healthcare decisions, or their healthcare surrogate or proxy. In other situations, the courts have guardianship and the right to give informed consent for a client who is not able to consent on their own. With the exception of emergencies, informed consent must be obtained. Next consideration, the nurse is responsible and accountable for the verification of and witnessing that the patient or client or the legal representative has signed the consent document in their presence and that the patient or the legal representative is of legal age and competent to provide consent. So, those The sole responsibility of the nurse, aside from being a client advocate, is just to witness that the client signs the consent on his own free will and is mentally competent or cognitively intact. So that is the role of the nurse, just to witness that the client signs the consent. Next consideration. The most important part of the consent process is informing the client. A client's signature is meaningless if the client is not informed. Nurses are often told that when they obtain a client signature on a consent form, they are only witnessing the signature and not verifying that informed consent was obtained. However, nurses have ethical and professional accountabilities to ensure that the client is fully informed and capable of giving consent. So, what does this mean is that if the client is about to sign the consent and then you ask the client, do you understand the procedure? And then the client tells you, no, I'm still confused about the procedure. So what does the nurse do? The nurse should call the healthcare provider or the surgeon so that the healthcare provider can answer the questions of the client before he or she is able to sign the consent. It is the healthcare provider's responsibility to explain to the client about the procedure, the risks, and the benefits. It is not the responsibility of the nurse. The only role of the nurse is to witness that the client signs the informed consent. So if there are any questions before signing the consent, the nurse must call the healthcare provider or the surgeon so that they can answer the client's questions. Next consideration. Nurses should ask clients if they understand what it is they are consenting to and if their questions about the proposed treatment have been answered. In any situation where the nurse believes the client has less than a full understanding of the proposed treatment, the nurse must act as a client advocate to ensure that the client receives the necessary information. I've just explained that on the previous consideration that if the client has more questions before signing the consent, the nurse should call the healthcare provider so that they can answer the question of the client about the procedure, the risks, the benefits, and alternatives before the client or the legal representative signs the informed consent. Now, last consideration. Sometimes, due to illiteracy or disability, a client may unable to append a full signature in a name to a document like informed consent as an attestation that its content has been reviewed and approved by the client. An X mark signature can be placed by the client in lieu of an actual signature. In order for it to be valid, the X mark signature must be witnessed by the nurse. So if your patient or if the patient or client cannot put a full signature because the client may be illiterate or disabled, then the client can just put an X mark signature on the signature panel in replacement for an actual signature. However, the important thing is the nurse should be a witness that it is the client or the legal representative who put an X mark signature on the informed consent form. Okay, I think that's it. Thank you so much. Thank you for listening to me. I hope I was very helpful to you. If you haven't done so, please click that subscribe button. Please like and comment and share this video to your friends, classmates, to other nursing students or nursing graduates that you may know of. See you in the next video. Take care and happy nursing.